dear faculty and respected.
What is CPR? So, cardiopulmonary resuscitation. Today's program is it's a training program. It is very essential and important for you to save a life in emergency. So, today's program is cardiopulmonary resuscitation, and I will give you a brief introduction. Then our senior physician, accidents and general cases, diabetes, hypertension, every case, and you all know very well about our senior physician, Dr. Ramamurthy. He will give you the detailed training program. So, cardiopulmonary resuscitation. Cardio means heart, pulmonary means lungs. When heart stops, everything stops. Why? Because blood circulation will be stopped. ఇంజన్ మోటార్ ఆఫ్ చేస్తే మొత్తం నీళ్ళు అయిపోతాయి. ఇంజన్ ఆఫ్ చేసినాం అనుకోండి, చెట్లకు నీళ్ళు పోతాయా? బాడీకి కూడా బ్లడ్ పోదు కాబట్టి కొలాప్స్ అయిపోతుంది బాడీ సడన్గా, హార్ట్ అయిపోతుంది. కార్డియో పల్మనరీ రిసస్టేషన్ ఇస్ డన్ వెన్ కార్డియాక్ అరెస్ట్ ఇస్ హ్యాపెండ్. సో ఇది ఏంటంటే మీకు మీ ఇంటి పక్కన కావచ్చు, మీరు మీ కాలేజీలో కావచ్చు, మీరు ఎక్కడున్నా ఏదైనా ఒక వ్యక్తికి సడన్గా పడిపోతే, మీకు ఆయనకి గుండె ప్రాబ్లం వచ్చింది, కార్డియాక్ అరెస్ట్ అయ్యింది, పల్స్ లేదు, బీపీ లేదు, కెరోటిడ్ పల్స్ లేదు అని అనుమానం వస్తే వెంటనే ఈ ప్రోగ్రామ్ అనేది స్టార్ట్ చేయాలి మనం. సో వితిన్ సెకండ్స్, వితిన్ మినిట్స్, వితిన్ 6 minutesలో ఎంత ఎర్లీగా స్టార్ట్ చేస్తే అంత సర్వైవల్ ఛాన్సెస్ ఎక్కువ ఉంటుంది, పేషెంట్ని బతికేయడం ఛాన్సెస్ ఎక్కువ ఉంటుంది. కాబట్టి అందరూ తప్పనిసరిగా తెలుసుకోవాలి. మీకు ఆ పైన ఇంకేమైనా డౌట్స్ ఉన్నా ఇప్పుడు సార్ అడగవచ్చు. ఇంకేమైనా డౌట్స్ ఉన్నా, క్లారిటీ లేకున్నా, మీరు ఎనీ టైమ్ యూ కెన్ కన్సల్ట్ అస్, యూ కెన్ కాల్ అస్, యూ కెన్ డైరెక్ట్లీ కమ్ టు అస్, అండ్ వీఆర్ హ్యాపీ టు బి హియర్. యూ హ్యావ్ ఎ వెరీ గుడ్ అండ్ యువర్ beloved principal. Thank you. And I would like to call our physician, Dr. Ramamurthy sir, to give the detailed description about CPR.
Principal like Ramesh sir. So today, actually, nowadays you might have heard or might have seen the below 30 years. So many people, they have died because of cardiac arrest without any reason. Below 30 years means there will not be any diabetes. There won't be any hypertension. So no risk factors. Maybe 30 years maybe some people have smoking or some people alcoholism. Okay, without alcohol, without smoking, without diabetes, without hypertension. So nowadays happening that. So 30 years, below 30 years, so many dead because of cardiac arrest. So whatever the cause, whatever be the cause, either because of any underlying cause, what we have to do at that time, that is the most important. Either below 30 or above 30. Above 30, most of the patient they may have hypertension, diabetes, smoking, alcohol. That is, alcohol is smoking. Slowly it is getting out, but alcohol in Telangana, that is very highest. Without alcohol, no function, no festival, no relationship at all. Even the relative won't come to our house without alcohol. Suppose if you doesn't provide any alcohol, next time he never come to our house. That is the importance of the alcohol in Telangana. So these are the risk factors. Alcohol, suppose if you take alcohol daily 90 to 180 ml per day for years, it may cause cardiac arrest. That means it may cause heart attacks. This hypertension and diabetes, these are the most important things that causes heart attacks. So today, whatever the cause, either diabetes or hypertension or without any cause or anything, below 30 years, some heart congenital problems will be there, like mitral valve collapse or HO scheme, hypertrophic cardiomyopathy. One thing I want to say is, HOCM, that is a very common in young people. Actually, we don't know. If we go to the hospital and go to the doctor because we won't get any symptoms of the HOCM. While running or while doing exercise or while brain shaping, they may suddenly collapse because of HOCM. So anything abnormal, congenital abnormalities of coronary. To do CPR, cardiopulmonary resuscitation. The actually normal circulation, everybody knows. The blood, heart pumps the blood to the different organs. The most important organ is brain. Other important organs, liver, kidney. These are important organs. So suppose a brain can sustain, that means can alive without oxygen for 6 minutes only, not more than 6 minutes. So suppose any patient gets on heart attack or cardiac arrest. I think you might have heard of Puneet Rajkumar. Another person, Gautam Reddy, minister in Andhra Pradesh, from Andhra Pradesh. While Taraka Ratna, recently, Taraka Ratna, while walking, he suddenly collapsed. He got heart attack. After that, cardiac arrest. Because of these things, the government of Telangana, they came to the conclusion that CPR is a part of should be a part of education. So they have started all the primary centers, from the primary health centers to the tertiary healthcare centers. So a part of this one, I myself started. Why should not I start this one? Awareness programs I started. For first time, I have started this CPR program at another degree college. So this is the second. Moreover, I thought that this is a medical fraternity, medical people, they must know. So, what I suppose CPR, what if not done within 6 minutes, patient will die. You might have seen most of the patients when they collapse in the roads or while walking or suddenly at the bus stands or railway stations. What we do, just simply we carry the patient to the hospital. We don't know. So, how to do CPR. Actually, we don't know what is CPR. Previously, CPR means CPR should be done by the only medical professions like doctors, nurses, compounders. So that is not right now. It's only everybody has to practice CPR. Whoever is educated, they have to practice CPR. They have to save their lives. So within 6 months, we cannot reach the hospital by taking the patient to the hospital. So immediately when the patient collapses at the site, we have to start CPR. CPR means, if suppose how to do CPR, what to do. If not do within 6 months, patient will die. So immediately we have to keep the patient in lying down position. You have to keep the airways very straight. One thing is, 3 things: A, B, C. Airways, breathing, circulation. They should be. You have to see A, B, C. You have to maintain all these things. So say the airways means you have to straight from nostrils to from actually back. So nostrils and trachea and the lungs will be the same line. So this you have to keep separate. Next thing is when the patient, whenever you see the patient with the collapse, first thing, whether patient is breathing or not. Simply you see the abdomen. Whether it is moving or not. Abdomen, suppose the respiration is stopped, it doesn't move. Once after no respiration, if it is experienced, you can see the pulse. Actually, if you are medical side, just you have to see the carotid pulse, not the arterial, this one, the radial pulse. Carotid means you have to see the neck. Suppose sternomastoid is there, medial side. This is sternomastoid muscle. Medial to that means inside the muscle. Inside the muscle, below the angle of the jaw. Then you palpate here. Because this carotid artery is near to the brain, you can you suppose radial may not be felt sometimes, so carotid must be felt. You have to see the carotid. If you are aware about this carotid, if not, just see the abdomen. If the abdomen is not moving, that means patient is something in danger. No, you stop. You call the first 108 ambulance. You have to another person call the ambulance. Then you start CPR. CPR means I will show the demonstration. So chest compressions. You have to start chest compressions. 2 persons. That is 120 compressions per minute or 30 compressions followed by the 2 mouth to mouth respiration. You start 30 compressions, then another person mouth to mouth respiration. So you have to continue till the ambulance reaches that place. You should not stop. You should not stop the CPR. How long? Whether it may be 1 hour, 2 hours, or 6 hours, then maybe there is a chance of living. Because one thing you have to know that usually when you are living, there is a 100% blood circulation to the brain. What is more important? Blood circulation. Blood carries to the oxygenated blood to the brain. So if the patient on cardiac arrest, there is no blood supply, that means there is no oxygen to the brain. Once the oxygen is not there for 6 minutes, the nerve cells, they may not live. They start dying. So suppose if you do the CPR, there is a chance of blood circulation 20% of the normal. If 20% of the 20% if the 20% blood circulation is there to the brain, there is a chance of nerve cells to survive. So that is the importance of CPR. If you do the CPR, at least 20% circulation is there for the brain. There is a chance of nerve cells revive. There is a chance of stopping dying of nerve cells. So that's the importance of CPR. Till the once it is reached, ambulance is reached, there will be a automatic external defibrillator, that is AED. So in that ambulance, it should be there. Every ambulance should have a one automatic external defibrillator. Only combination of CPR and automatic external defibrillator, there is a chance of survival of the patient. Without only with CPR only, patient may not survive. There should be some automatic external defibrillator. So in India or in a very well-developed countries, all ambulances will have an external automatic external defibrillators in ambulance. Suction, ventilator, these 3 must be there. In India, there is no such ambulance. Only in well-developed cities like Hyderabad, where Apollo hospitals, well-developed care hospitals, they have an automatic external defibrillator. It was very limited. Even Suryapet like hospital, there is no, not at all, no ambulance. Ambulance is there, but they will have only ventilator and suction. Automatic external defibrillator is not there. Maybe all the defibrillators may be in the medical college hospitals. Even in private hospitals, in the other only defibrillators are there in 1 or 2 private hospitals. Actually, this is the common thing. The cost of automatic external defibrillator will be 1.5 lakh. It should be there even in colleges like pharmacy colleges, even small PSCs, in medical shops, small hospitals. They should be there. They must be there. These are automatic external defibrillators must be there. Combination of CPR and this combination. So importance of automatic defibrillator is, suppose once CPR you have done, there is a chance of, suppose if you attach the defibrillator, only simply the vent will be there, keep the machine there. So automatically the sends the impulses, they regulate the heart rate. It brings the heart rate to the normal position. They start the heart beating. So normal regulator. So to maintain the this one heart rate, the external defibrillator means defibrillator is shocking, just like shocks, electrical shocks. Just like shock. But I think automatic out away this could be. So kasara heart start they will send the blood to the brain. That is a defibrillator. So these combinations automatically there is a chance of patient. Recently, Mr. Ramesh Naik has done CPR one patient and one person collapsed at our near New Bus Stand. Patient survived. They shifted to the hospital until his patient survived. So that is the importance of CPR. So everybody must know. So now we'll start the demonstration for this one. The boys and girls, they can come and here, they learn how to do it. So hearing is different, practicing is different. You can hear what is important theory, but practice are most important. We have to practice ourselves, then only we can know that. So now I can call some two our boys. Center of the chest, you have to see. You have to lock hands to each other, then you see.
We have to press, we have to give compressions.
Always you have to keep this heel of the palm. Heel of the palm on the chest, center of the chest. So first, before that, you have to lock this one. Whatever is right on, left on, where you can keep anything. So this one, you keep this heel of the palm on the center of the chest. Center of the chest, you can see. Always, it should not be, elbow should not be bent. Elbow should be very straight.
ఇలా గట్టిగా చూడండి. ఇలా ఎంతసేపు చేయాలి?
30 compressions over.
30 compressions 30 times చేసినాక పేషెంట్ బ్రీతింగ్ తీసుకోడు కాబట్టి మౌత్ టు మౌత్ బ్రీత్ చేయాలి. పేషెంట్ గుమ్మలో కట్టుకుంటాడు, గాలి తీసుకోడు కాబట్టి మనం ఏం చేయాలి? ఇలా మన మౌత్ ఓపెన్ చేసి మన మౌత్ ఇట్లా పెట్టి గాలి ఊదాలి.
2 breathings.
30 compressions చేసినాక ఒక్కసారి ఊదాలి.
2 breathings. So what is the importance of it? So usually when you inhale, you will have an oxygen content in the air. When you exhale, there will be carbon dioxide. But some amount of oxygen is there, 40 to 80% carbon oxygen is there in exhale air or exhale. So that will also help the patient. So definitely mouth to mouth respiration. If not possible, then you can only CPR can help. If possible is there, if you are aware, you can do mouth to mouth, you can do.
Again, compressions first, 30 compressions. Elbow should be straight forward and locking because we need strength. Strength కావాలి. వస్తలేము కాబట్టి లాక్ చేయాలి. ఈ పైన లాక్ చేసి ఈ భాగంతోనే గుండె పైన అంటే గుండె ఎక్కడ ఉంటుంది? లెఫ్ట్ సైడ్ సెంటర్ ఆఫ్ ద చెస్ట్. ఇక్కడ ఈ భాగంలో ప్రెస్ చేయాలి. కొన్నిసార్లు రిబ్స్ కూడా ఫ్రాక్చర్ అయితే ఇక్కడ ప్రెస్ చేస్తాడు, కానీ పర్లేదు. రిబ్స్ ఫ్రాక్చర్ కంటే పేషెంట్ బతకడం ముఖ్యం కాబట్టి కంప్రెషన్స్ కంపల్సరీ గట్టిగా 30 కంప్రెషన్స్ ఇచ్చాక మౌత్ టు మౌత్ బ్రీతింగ్ ఇవ్వాలి. ఇచ్చిన ఇదొక కంప్రెషన్, ఇదొక మెథడ్. 120 కంప్రెషన్స్ పర్ మినిట్. సపోజ్ మౌత్ టు బ్రీతింగ్ చేయలేకపోతున్నాం, మనం కంప్రెషన్ చేస్తున్నాం అంటే 120 కంప్రెషన్స్ ఇవ్వాలి 1 మినిట్ కి. 60 సెకండ్స్ కి 120 కంప్రెషన్స్ అంటే 1 సెకండ్ కి 2 సార్లు వస్తాయి మనం.
We have saved so many patients in ICU. Sometimes they need poisoning. Last stage they will come without any respiration. We will do the CPR. Once they then we keep the patients on ventilator. Sometimes cerebral vascular accidents, paralysis, some accidents. So all these patients they require some CPR. But on the road, suppose accidents there, when some particles inside the mouth, we have to remove. Otherwise, directly you should not do. So these are some conditions are there. Definitely, it will help. It will save the patient. So now I request boys.
You did a good. Yes, excellent.